Okay, we have the cardioesophageal junction here, cardiac type mucosa, a little bit bluish, basophilic. Again, no intestinal metaplasia apparently. I do not see goblet cells, but the epithelium looks very bluish, very basophilic to me. In high power, basal cell orientation of the nuclei, no architectural distortion, no budding, no cribiform structures, no abnormalities for high-grade dysplasia, but a little bit of pleomorphism, nucleoli occasionally prominent, some dilated glands with necrotic debris in the lumen. I did a PAS Alcian Blue stain trying to find goblet cells, no blue cells, no goblet cells. So is this an intestinal metaplasia? What's your diagnosis? Can you call these Barrett's? What about dysplasia? Okay, according to the American pathologists, no goblet, no Barrett's. You need goblet cells to call a lesion Barrett. The British Society of Gastroenterology define Barrett's as columnar epithelium visible macroscopically in the tubular esophagus, and they accept the presence of goblet columnar, non-goblet columnar epithelium. So what's my problem here? First, obvious endoscopic Barrett's impression. Second, the mucosa, in my opinion, looks bluish, basophilic, not the usual cardiac mucosa. Third, I showed the case to a pathologist. 5 told me that they think it's low-grade dysplasia. And fourth, there are some studies, 12-year studies, showing that columnar epithelium with goblets, evolution to cancer 4.5% in 12 years. Columnar without goblets, 3.5%. How can I prove that intestinal metaplasia is present here, that there is intestinal differentiation? With this stain, CDX2. I did the CDX2 intense nuclear staining in the abnormal epithelium. And this slide, this picture shows something very important. If you stain the stomach or the cardiac type mucosa, they are CDX2 negative, with the exception of intestinal metaplasia. The green arrows show the cardiac type mucosa, negative. The red arrows show the abnormal mucosa with intestinal metaplasia. So my final diagnosis was esophagus with extensive intestinal metaplasia and low-grade dysplasia.